including right now, stay-at-home orders, curfews, kept schools closed, and suspended most businesses from operating. None of those things have happened here or in Alberta, in part because we know that our economy has been hit harder than elsewhere, and we were already experiencing a pre-COVID mental health crisis in our province. We also have to maintain broad public support for and compliance with public health guidelines and restrictions. So in trying to strike this balance, it is important that we show Albertans that there is a path forward, that if we continue to do collectively the right things, bending that curve down further and further reducing pressure on our hospitals, that we can gradually relax public health restrictions. But this must be done carefully, slowly, and in a way that is driven not by opinions, but by data. And that is what I want to focus on now. Alberta's path forward will be a stepped approach to easing restrictions based on hospitalization benchmarks. Total hospitalizations, both for ICU and general acute care, is the key metric that will guide how and when we ease public health measures. We chose hospitalizations because it's a clear indicator of healthcare capacity. It's also a lagging indicator, which means it gives us a better idea of how relaxations affect the healthcare system. Daily case numbers and case growth are leading metrics and better reflect recent transmission trends. Daily case numbers and growth will be used to guide decisions around the need to pause further relaxations or potentially to increase restrictions if the virus once again poses a growing threat. And let me pause here to make an absolutely clear point. If cases of COVID-19 surge again, if we start moving once again towards exponential growth like we saw in November, December, and if somehow one of these new viral variants takes hold in our community and begins to spread at rates seen in some other parts of the world, we will have to impose stronger restrictions again. Hospitalizations will be used to guide decisions around easing restrictions. When a hospitalization benchmark is reached, decisions will be considered for moving to the next step of relaxing restrictions. To be clear, the hospitalization benchmarks will be the primary factor, but we'll obviously have to look at whether we're back into a growth of the virus. Once we move into that step, we will reevaluate hospitalizations 3 weeks later. I'll have more detail on the 3-week period later on. If by that time hospitalizations have fallen even further to the next benchmark, we'll consider moving into that next step. So I'm now going to walk you through the plan that we have developed and based on the advice of our public health experts, one that sets out specific benchmarks to drive each stage. As we walk through the steps in our path forward, it is important to understand that there will be a progression of easing that occurs at each step. Some degree of restrictions will still apply to all activities within each step. As of today, we are in what we are calling early steps. Schools have returned to in-person class. Outdoor social gatherings of up to 10 people are allowed. Personal and wellness services are open for appointment only, and funeral service attendance is now capped at 20 people, up from 10. And let me pause there to just emphasize the importance of our decision made in December to reopen the schools at the beginning of, or the middle of January, because that's 720,000 people who are learning together and working together. That's hundreds of thousands of families who have the support of those schools, the mental health support that kids get at those schools, a critically important part of our step forward towards reopening. Step one will include some easing of restrictions related to the functioning of schools, including indoor and outdoor children's sports and performance, and easing of some restrictions related to indoor fitness for adults. We'll also allow for some dine-in options for restaurants, cafes, and pubs. Now, these activities will still be bound by clear limitations. For example, there will be physical distancing requirements, activity restrictions, group size limitations, and masking, amongst other mandatory measures. And let me pause there to say that with respect to step one, we have now, in the last 2 or 3 days, achieved the threshold of moving below 600 hospitalizations. And the last step towards relaxation of public health measures was on January the 18th. And so we are comfortable to proceed with this step one on Monday, February the 4th. Now, some people might say, why aren't you doing this immediately? I reiterate that we must do this in a careful, gradual, stepped approach. Why? So we can assess the impact, the full impact of each stage of relaxations. What business people tell us is the last thing they want is a roller coaster. They don't want the so-called yo-yo effect of opening and closings. That's why we have to be careful and deliberate and allow for the full 21 days to elapse between measures. So we will be taking the step one measures on Monday, February the 8th. Step two would proceed only after we see the weekly average for hospitalizations drop below 450, easing some restrictions for retail, community halls, banquet halls, hotels and conference centers, and there will be some further easing of restrictions on children's sports and performance activities, as well as indoor fitness. And I repeat, at least 3 weeks must elapse between two steps to allow us to assess the impact of gradual easing. When we reach a hospitalization number of 300 COVID patients, things will open up a bit more at stage 3. Easing of restrictions related to places of worship will be considered, as well as consideration for limited reopening of museums, art galleries, libraries, casinos, indoor seated events, movie theaters, and bingo halls. We'll also consider at that point indoor social gatherings with limitations. All, of course, with mandatory health measures in place to limit the risk of viral transmission through each of these activities. Step 4 could potentially see us back to a similar position as we were in last summer, in summer of 2020. There will be restrictions, but significantly more options for Albertans and Alberta businesses. But we won't start considering easing these categories until we see hospitalization numbers of under 150. At this point, easing would be considered for a wide range of indoor and outdoor activities, many of which have been greatly missed by Albertans. Festivals, weddings, funeral receptions, wedding and funeral receptions, I should say, indoor concerts, trade shows and rodeos are amongst the possibilities of some easing of restrictions at that 4th stage. Again, all will be subject to specific health measures to ensure that we continue to proceed safely, but stage 4 brings us back to within what many would consider to be normal. These steps represent the ideal situation of continuous decline in hospitalizations, and that's based on continued adherence by all of us to existing public health measures. But as I stated earlier, there are factors that could severely curtail our progress, which is why we are taking a gradual, stepped approach. We also know that as measures are eased, there will be the risk of greater community spread and case growth. And that is to be expected as more contacts between people are made and more people are participating in different kinds of activities. That is why moving from one step to another will not be done automatically once a benchmark is reached. If after 3 weeks the numbers are in the range of the next benchmark for hospitalizations, decisions will be made to move to the next step. Although we are using hospitalizations as our metric to ease measures, we will also pay, and this is very important, we'll pay constant attention to leading indicators like new cases, active cases, the positivity rate, and the R, or the reproductive value. These leading indicators are not what will provide more immediate red flags. They will provide, I should say, immediate red flags that will tell us if we should stop, regroup, and potentially tighten restrictions. This is a careful and balanced approach to protect both lives and livelihoods while balancing physical, mental, and emotional health concerns and protecting our healthcare system. At each step, we'll provide Albertans, organizations, service providers, and businesses with the details for every measure that is eased. We know Alberta businesses have been hit hard, and we're thankful for their continued efforts and patience. Our Minister for Jobs, Economy and Innovation, Doug Schweitzer, will be making further announcements about increased business supports in coming days. And based on feedback that we're getting, I should say, from Alberta businesses, we recently did expand the eligibility of the Small and Medium Enterprise Relaunch Grant to include businesses that had started between March 1st and October 31st of last year. So far, this funding has helped thousands of businesses, and the program will continue to accept applications. We've moved quickly to process more than 45,000 grant payments, totaling more than $315 million in support, in addition to our abatements on taxes, on WCB premiums, our participation in the federal rent assistance program, and of course, we remind business owners that there are other supports, including the wage subsidy program. We hope that opening further activities as part of Step 1 on February 8th will be another boost to some Alberta small businesses, such as restaurants and personal trainers, for example. We've made significant progress, and we cannot lose sight of that. The more we see our numbers go down, the clearer our path forward becomes. But let's not let our guard down, and let's keep working hard to get those hospitalization numbers down so that we can stand here sooner than later and announce more good news. But let me just pause to say this, that folks, we are not through the end of this yet. Unfortunately, because of the constraints on vaccine supplies, it will be some time into 2021 before we see the impact of vaccines having a real positive effect on hospitalizations and COVID-related fatalities. With the new variants that are circulating around the world that are far more contagious, we must be actually more cautious in some respects than we have been before. So please do not take today's announcement as a kind of encouragement just to go out there and return to normal patterns of socializing and social interaction. Because if we make that mistake, what will happen is we'll lose the progress that we've made to date. We'll start piling up more pressure on our hospitals again. We'll start threatening the ultimate capacity of that system. We'll have to start canceling surgeries and non-urgent care again. And then, unfortunately, we would have to bring in additional restrictions again. Avoiding that fate is in all of our hands collectively. And with that, I'd like to thank you and turn it over to Dr. Hinshaw for her daily update.
Thank you, Premier, and good afternoon, everyone. Over the last 24 hours, we have identified 543 new cases of COVID-19 and completed about 11,600 tests. Our positivity rate currently stands at about 4.5%. There are currently active alerts or outbreaks in 291 schools, or about 12% of the schools in the province. Currently, these schools have a combined total of 607 cases. There are 594 people in hospital, including 110 in the ICU. Sadly, 14 new deaths were reported to Alberta Health in the last 24 hours. While the number of COVID fatalities are trending downward, every death is a tragedy to those who love them. My thoughts are with anyone mourning the loss of someone, whether from COVID-19 or any other cause. We have also identified 12 more cases of variant COVID-19. In Alberta, we have found 31 cases in total of the strain first identified in the UK and 6 total cases of the strain first identified in South Africa. Of these 37 cases, all but 3 are linked to travel. These 3 are all from the same household, one of whom is the case unrelated to travel, which I referenced on Monday. AHS is working hard to prevent spread and ensure that any close contacts of all cases are isolated and getting tested. We still have no evidence of further spread in the community at this time. These cases, however, are another reminder of why we must be cautious. As we work to find the right balance of minimizing the impact of COVID on our health system while keeping in place only the public health measures we need, I know many Albertans are keen to return to the activities they love and have missed dearly over the last number of weeks. This path forward shows us what we need to achieve together to be able to do that safely. We're taking this approach to ensure that we are not risking hospital capacity for Albertans when they need it most. This is vital to ensuring that expert care and services are available for all Albertans when they need it, regardless of whether it's from COVID, a car crash, or any other medical emergency. We all have a role to play in the reduction of COVID-19 cases in the province. Most important of all is to continue to follow the public health orders in place in detail and in spirit. Our declining numbers through January prove how effective the measures can be when Albertans work together to protect each other and our healthcare system. We can further slow the spread of COVID-19 and protect ourselves from the risk of variants by continuing to limit as many in-person interactions as possible in every facet of our day-to-day lives. If each of us continue to find ways to replace these in-person interactions with other alternatives, together we will further reduce our case counts, which help to relieve pressure on our healthcare system. We will also help prevent any spread of the new variants of concern in our province. As I've said before, none of us can do this alone. It takes all Albertans working together to combat COVID-19. We've shown before the collective power we have. Let's harness that power once again to save lives and help us safely ease restrictions. Thank you, and I'll turn it over to Minister Shandro for some remarks.
Thank you, Dr. Hinshaw, and thank you, Premier. Good afternoon, everyone. I'd like to start off by saying that I'm proud to say that Alberta has now administered over 104,000 doses of the COVID-19 vaccines. More than 14,000 people as well are now fully immunized. That means they've received both of the doses. And like the rest of Canada, we're using 2 vaccines, just to remind everyone that there's one from Pfizer and another one from Moderna. And as I mentioned yesterday, federal officials informed us that we will be receiving 63,000 fewer doses of the Pfizer vaccine during the first quarter, or Q1, of this calendar year. Today, the news got worse when Moderna announced that it will be delaying up to 25% of next month's shipments to Canada. So once again, our country and our province is not a priority. And so what does that mean for us? Alberta Health was advised this morning that next week's shipment of Moderna vaccines has been cut. We had been expecting to receive 24,600 doses. Instead, we'll be getting 18,800 doses, or 5,800 doses fewer than what we had expected. So that's a 23.5% reduction, and it means that almost 6,000 seniors and other healthcare workers will not be getting those vaccines in the amount of time that we were expecting to be able to provide it to them. What's more alarming is that we've been told that all Moderna shipments for February and March are being reassessed while we wait for decisions from Moderna. This means it's impossible to say exactly how much Moderna vaccine Alberta will be receiving in the weeks and as well as the months ahead. We're currently assessing the impact that these reductions will have on our ability here in Alberta to provide second doses, or when we'll be able to start offering first doses again. But that's hard to do when the delivery schedule is filled with question marks. A lot will depend on how much vaccine actually arrives in Alberta during the next month. So at this point, I know that many Albertans are frustrated to hear about cuts to vaccine shipments day after day. Let me say, we are too. The news from Ottawa is going from bad to worse. The reality is our plans depend on the supply that we receive from the federal government, and the numbers are changing every day. There is absolutely no reason that Canada should be 20th in the world for vaccine doses administered. We should not be trailing so many other countries throughout the world. Over the weekend, we'll continue working with the federal government. We'll keep calling on them to come up with a plan of action to solve this. We've heard promises to make phone calls, and we've heard excuses. What we haven't heard is, and what we desperately need, is a clear national strategy to improve vaccine supply as soon as possible. And now this isn't about politics. It's about leadership. It's about delivering help when it's needed the most. We need more doses, and we need it now. People want to hear who's getting the vaccine, and they want to hear about when it's going to happen. And we want to tell them, but we can't make plans for vaccines that we don't have. We can't make lists of who will get the vaccine a month from now or 2 months from now when we don't even have a delivery schedule that we can rely upon. In the meantime, once again, I'll give Albertans the two promises that I can give. First, we will keep using every vial that we get with the smallest amount of waste that we possibly can, regardless of whether the label says 6 doses or 5, and regardless of what syringe we need to use it. And the second is we'll keep rolling the vaccines out to the people who need it the most as fast as the federal government can get them to us. Thank you very much, and we're happy to take questions. Christine?
So we'll open it up to the phone lines now. Just so we can get to as many questions as possible, we ask that you limit yourself to one question. Operator, can you please put through the first caller?
First question is from Kelly Kreiderman with the Globe and Mail. Go ahead, Kelly.
Hi there. Thank you for taking my question. I am wondering if the message today that things can start to open 1 week from now doesn't fit with the messages that we have heard from Minister Shandro and Dr. Hinshaw in recent days, that the restrictions are working, that the variant poses a great unknown risk, and that the province needs to proceed with caution. We've seen the federal government do further lockdowns in terms of travel this week. How does this fit with the trends that we're seeing about the variant?
Sure, I'll start off. I'll say this, that the important message for everyone to hear is that there's I guess, two different things. There's about stepping up and stepping down measures, and we need to be clear to be able to provide people a roadmap for a path forward in how and when we as a province can do it. So what we're doing right now is providing people with that roadmap about how it can happen, and it would happen using hospitalizations as that indicator. Now, that is separate from if we ever do see increases in our daily case counts and see those numbers increasing, then of course we're going to continue, as we have throughout the pandemic, to work with our public health officials and Dr. Hinshaw's office to be able to look at that data and see what measures might ever be required for us to be able to step up measures again throughout the rest of this pandemic. Premier, you wanted to supplement that?
Yes. Sorry. Thanks, Kelly. I would just add that we're taking a very gradual, step-by-step approach here. Some of the things that we are gradually relaxing are already available for the public in our neighboring provinces of British Columbia and Saskatchewan. British Columbia that has had success in maintaining low levels of hospitalization and cases relative to most of Canada, and we'll monitor these very closely. But Kelly, as we've said from the beginning, we are trying in this province to manage risk and to balance many different, very important pressures and considerations. And one of those is the enormous there's a mental health crisis in this province that has been deepened and worsened by the economic damage of the past 10 months. And some of that is due to restrictions to tell business owners, small business owners, that they may be shut indefinitely, to give them no path or sense of hope, leads to even greater despair. Will, to quote Governor Cuomo in New York recently, if we don't begin reopening some of these businesses, there won't be some of these businesses to reopen. And so we have to give, I think, a measured path that is safe, but also presents a sense of hope that people can recover, and that there are outlets as well for people to improve their mental and mental and emotional health, like increased opportunities for physical activity in schools and for adults, all with very narrow guidelines. So I'll remind you on the in-dining service at restaurants, this would be limited to 6 people from one household, or an individual and his maximum of 2 of their 2 identified close contacts. And that's really the key thing. The central thing in all of this is that as much as possible, people stick to their household cohort group, and of course all of the other layers of protection exist around this. Contact list for people visiting restaurants, distancing between tables, frequent sanitation, mask wearing, and all of those other measures. And I don't know, perhaps Dr. Hinshaw would like to comment as well.
Thank you, Premier. I would just reinforce that last statement, which is that although there are some sectors that as of February 8th, as long as our hospitalizations continue to trend downward and our cases continue to trend downward, we will be able to start slowly opening, but that there are restrictions still in place in those particular sectors. And I think the consistent call to action is to say to Albertans that in order to be able to continue this slow, stepwise approach, we all need to be very vigilant in every single activity we undertake to make sure that we're following all of those public health measures, and that ideally as we move forward, we're able to, again, strike that right balance between having a slow, gradual, monitored and safe approach, while at the same time, if we do see cases start to rise again, the ability to move backward if we have to.
Operator, can you please put through the next caller?
Next is Ashley Joanna with Post Media Edmonton. Go ahead, Ashley.
Hi, good afternoon. This is a question for the Premier and possibly Dr. Hinshaw if she has other things she'd like to add. There's a growing movement of people who are knowingly and willfully ignoring restrictions. At this point, the fines that AHS hands out don't appear to be a deterrent. And in at least one case, municipal officials have expressed support for businesses breaking the rules. I wonder what you think should be done in the cases where people are knowingly not following the rules. And are we at a stage where you would support more strict measures for people who don't follow the rules that are in place?
Thank you for the good question. Let me take the first shot at that one. So our approach has always been to begin with education and then to work with people for compliance, but only to use enforcement as a last resort if education and compliance don't work. And it is regrettable to see that some people are, in a very deliberate way, thumbing their nose at the law, and in so doing, at our public health. And when they do it, they are thumbing their nose at the ICU nurses who've been working around the clock. What they're doing is saying that their personal wishes outweigh the need to protect our healthcare system. Because if it's all right for one business or individual to do that, and then a growing number to do it, we end up in a situation where there's a total lack of equity, where businesses and individuals who follow the rules are effectively punished for doing so, and we end up potentially in a situation where we end up having to impose more stringent restrictions on everybody if we get back into exponential growth, piling up more people with COVID in the hospitals, canceling more surgeries. So this is not a joke. This is very serious. And look, I understand people being frustrated and angry with restrictions. People have every right to be deeply frustrated. I especially understand business owners who have been going through incredible stress. But that stress is not going to get any better if we see widespread violation of the public health measures in this province. And I would plead with those Albertans to take a step back and look at this objectively and have a fair mind. The truth is, if you're trying to operate in many other places around the democratic world, well, we've continued to avoid a lockdown style policy here. And that's because of the general spirit of respect that Albertans have shown for the measures. But in Quebec and Ontario right now, stay-at-home orders. In Quebec, curfews, the schools that are shut down, the majority of businesses in many jurisdictions that have been shut down. Here in Alberta, over 95% of businesses are able to operate without significant restrictions from public health measures. So we have tried very hard to maintain that balance, but it depends on people being responsible. And quite frankly, to see people in elected government positions encouraging a flagrant disregard of public health measures during a pandemic like this is totally irresponsible. So our approach has been to start with education and then to work with people towards compliance. But it's clear to us that there's going to have to be stronger enforcement action to maintain a level playing field so that law-abiding individuals and businesses are not punished for respecting the rules. And Doctor, would you like to add to that?
I think that's clear. I would just want to emphasize that it's important to remember that the majority of Albertans continue to follow the restrictions in place, and we cannot let the actions of a minority dictate, again, what the majority get to do. So just a reminder that the more of us who follow the measures in place every day, the faster we'll actually be able to get to a point where we can ease restrictions. And it's in all of our best interests for us to work together towards that end.
One thing to this, because I've heard some of those people encouraging this kind of irresponsible action. I've heard them saying that their justification is they're not afraid. They're not afraid of COVID. It's not going to affect their healthy young or middle-aged people, and this is only something that affects, quote unquote, the elderly and frail. So they're not concerned. It's what they're saying, folks. Don't you understand now? We're at 11 months into this, that the death rate for the elderly and frail is directly correlated to how much spread we get in the general community. That is the reality. We do not live in a situation where we can perfectly segregate the elderly and frail from the rest of society, and that's true everywhere. And by the way, maybe you will be affected. I have a very dear friend, a leader in the Armenian community who is exactly my age and just died of COVID. It is real for people. Yes, people who are elderly and have health frailties are more vulnerable, and maybe they're not the ones who are breaking the rules by going to socialize and violating these restrictions. But that's not the point. The ratio between cases and hospitalizations has remained absolutely constant across every age group in Alberta for 11 months. So what does that mean? If we get 1,000 new cases on a given day, we know that about 40 to 45 of those are headed to hospital. And we know that about 12 of those are likely to pass away. So general community transmission does cost lives. And that is why this is irresponsible and selfish, if you're breaking these rules flagrantly.
Operator, can you please put through the next caller?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon. Premier, how much of this decision, there's science involved in COVID and there's also politics involved in COVID, no surprise. How much of this decision today has to do with the growing frustration with restrictions, especially in areas of Alberta where your government has enjoyed great support?
Well, Rick, I'll tell you, every time we come to a discussion about COVID measures in the COVID Cabinet Committee, I always say to our colleagues that we have to make these decisions based on the best information that we have and not on political considerations. Obviously, one broader factor is the willingness of Albertans to comply with measures. And that's something we have to constantly monitor. We do polling on that. And I'll tell you what the polling says. 20% of Albertans believe that the current set of restrictions are too severe. About 40% say the current set of restrictions are about right. And about 40% say the current measures are not strong enough. So there is no overwhelming consensus amongst Albertans. And by the way, we've been doing that public opinion research going back since March, and the numbers have been pretty consistent. The percentage of those people who say that the current set of measures are too stringent and should be all eliminated is a smaller portion of that 20%. And I'll remind you that around Christmas time, there was some public opinion research done, which indicated Albertans had a higher percentage of Albertans avoided socializing outside their homes than in any other province. That is to say, we had higher compliance with public health measures over the Christmas season in this province with respect to socializing outside people's family cohort. So as Dr. Hinshaw said, I believe the vast majority of Albertans are doing everything they can to respect the measures and the spirit and the letter of these measures. And I do regret that there is a small minority of people who are, I think, insulting the efforts of everyone else to prevent the community transmission that costs lives.
Operator, can you please put through the next caller?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, this question, I guess, can be for the Premier and the Health Minister and Dr. Hinshaw. What specific data did you look at that shows the level of transmission and the level of risk is low for indoor fitness, restaurants, children's sports, all the things included in Step 1? And can you share those figures with us?
Well, I'll defer that to Dr. Hinshaw. I do know that there is a growing body of global research on the risk associated with different vectors of transmission, different social and economic activities. Of course, those risks can be mitigated with all sorts of additional public health measures. So it's not like I'll give you the example of indoor dining in restaurants, bars, and pubs. It's not like we're going back to business as usual there with the limitation to serving household cohort groups or one individual plus their two designated close contacts, plus 2 meters distancing between tables, plus mandatory mask wearing, plus frequent sanitation, plus keeping contact lists. So this is not just about, comparing restaurant businesses as normal versus closing them. These are very severe constraints that would still allow some level of operating. And I think that's an important factor, but I'll turn it over to Dr. Hinshaw to talk about risk assessment.
Thank you, Premier. Two things. First of all, there's a real-world example right next door to us in BC with respect to having limited ability to have some of these activities open. And we've seen that they have been successful in controlling their spread, and that's a really helpful example to be able to see how that plays out in operations. Again, as was mentioned, not to open these sectors completely, but to allow some opening with restrictions still in place. In addition to that, what we did is really looked at the evidence of where transmission is most likely to happen. And what we've seen is that group fitness events are high risk of spread when people are in a group and exercising together, especially high intensity. And so some of the restrictions that would be required for fitness business to open would be things like not having high intensity group fitness. And there will be more information coming in the week ahead about those restrictions, but what we're doing is using the evidence to help us open only those activities in those sectors that seem to be the lowest risk part of that particular sector. And so, for example, with restaurants, again, what we see is that when people are gathered around a table together, sharing a meal, eating and drinking, of course, not wearing masks because that's impossible to do, whether that happens in that household cohort's home or if that household cohort is at a restaurant, that again is a high-risk interaction, which is why opening restaurants will still require that be limited just to that household cohort or people who are living alone, again, those two people with whom they're able to interact. So those are the kinds of restrictions based on the evidence that we have.
We have time for 3 more questions. Operator, can you please put through the next question? Oh, sorry.
Next question is Carlisle Facette with CTV. Go ahead, Carlisle.
Hi there. My question's for Dr. Hinshaw. I'm wondering if you can give us an indication of how much the new COVID variant factored into your recommendations to government when putting together this stepped plan, and if you can also give us an indication on how confident you are that the variant in Alberta can be contained, that it won't see exponential growth itself.
There's a really key component of the plan, as the Premier described, which is that each small step is followed by a minimum of 3 weeks of observation, and that while the step down is one of the requirements is that we have to meet a certain level of hospitalizations, ensuring we have that capacity. The other requirement is that over that 3-week time period of observation, we don't see our case counts starting to rise week over week. And so, in my opinion, the ability to have a very slow measured approach, the ability to evaluate and observe each small step forward for that required amount of time, and the use of those leading indicators of case count growth and positivity rates and our growth rate, those kinds of things help us to be able to take action quickly should we need to. With respect to the variant, it is concerning that we have, again, identified the number of cases that we have. However, the benefit of having significant testing of incoming travelers is that we have been able to identify many of these cases and contain them. And the ability of us collectively to stop the variant from becoming a more dominant strain in Alberta, again, will be how well we do at observing all of those public health measures as we take these very gradual steps forward. Because the more people who step away from following public health measures every day, the higher the risk that encounters are encounters of risk and COVID starts to spread, whether that's the variant of concern or whether it's the COVID that's currently the dominant strain. So again, it really, as it always has been, is up to all of us to be able to maintain that forward momentum. But if our case count starts to rise again, we will have to stop that progress and consider going back.
Could I just add that while you're right to ask this question, and we are very concerned about the possibility of widespread transmission of the new variants, and that is a downside risk. There's also some upside positive developments that we factor into all of this. For example, the vaccine program not going as quickly as we would like because of supply, and nevertheless, it will incrementally protect more and more people, particularly those who are most susceptible to COVID. Secondly, we have significantly expanded our contact tracing operation, and so we're now able to complete on a typical day over 1,000 investigations, which is up pretty significantly, and so that gives us a little bit of extra capacity from the numbers we're currently seeing, and we've also seen, of course, greater constraints on international arrivals that to help more closely control the possible importation of the variants from abroad. So I think those are 3 upside considerations as well.
Operator, can you please put through the next caller?
Next is Rafi Boutikanian with CBC. Go ahead, Rafi.
Hi, this is for the Premier. Your government says you can't make plans for vaccine doses you don't have, and between Pfizer and now Moderna shipments being delayed, you will need to decide whose shots get delayed. So how will you make that decision?
I missed the last part, Rafi. We'll have to decide who's delayed. Well, I will refer that to Minister Shandro because he's more familiar with the details of the next steps in vaccines.
Yeah, with the glasses. I'm not usually wearing glasses. At least I didn't put it over my eyes like Paul. Is that too soon to say? Rafi, the news that we got today from Moderna is still new, so we're still going over it with folks from the ministry as well as Dr. Hinshaw's office. And so these decisions have not been made. Like we made, though, with the decisions when it came to the priority groups in phase 1, and when we eventually get to decisions related to phase 2, it's going to be on the recommendations of our public health officials, including Dr. Hinshaw and her office. So perhaps Dr. Hinshaw, I don't know if, because we haven't had a chance to discuss this yet, because this is all news for us today, but any further info that you'd like to give to that question from Rafi?
Thank you, Minister. All of the vaccine decisions and recommendations that we put forward are based on the data with respect to risk of severe outcomes. And so you're quite right that with this news having just come in, we still need to look at that number of doses and determine how that will impact the planning that we had underway. And it will be, as it always has been, to determine who is at the highest risk and how we allocate those doses.
If I could just add, well, that was very discouraging news from Moderna today. Rafi, you may also have heard the very disturbing reports out of the European Union that they appear to be moving towards export restrictions on COVID-19 vaccines produced in the European Union. This is something that the German government has been pushing for some time, and that could even further delay shipments. So that is why I think it's critically important that the Government of Canada demand that Pfizer respect its obligations to us through its Michigan factory, because if we are headed into several months of vaccine nationalism in the European Union, we need to find other sources of production. Obviously, the Pfizer facility in Michigan would be one of those. But what is so frustrating here is that we ended up with a situation without the relevant pharmaceutical production in Canada. Australia is able to, they have producers who produce Pfizer vaccines on license to that company. So Pfizer doesn't actually have its own production facility, but they will license local producers to do that. We started COVID, we became aware of COVID last January and February. I don't understand why the federal government did not, in that interval, press hard for the establishment of licensing arrangements for Canadian producers. So I think a huge opportunity was missed there. Anyway, that's just another risk factor here, which is the growing kind of protectionism out of the European Union.
Operator, can you please put through our last caller?
Yes, final question is from Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Premier. I want to hear you in French on something you've said about the willingness of Albertans to follow restrictions. Je veux savoir, Monsieur le Premier ministre, on a vu des commerces qui violent ouvertement les règles de santé publique, notamment des politiciens dans des petites villes qui sont allés manger dans des restaurants qui rouvraient illégalement. À quel point ça a été un facteur dans votre décision de rouvrir les restaurants en premier? Et quel est votre message pour ceux qui violent ouvertement les restrictions de santé publique?
Tout d'abord, je remercie toute la grande majorité des Albertans qui ont suivi les mesures de santé publique pendant toute la pandémie. Et c'est à cause de leurs efforts que nous avons diminué le nombre des cas, des cas en hôpitaux, etc. Et c'est la raison pour laquelle nous pouvons aujourd'hui publier ce plan pour pour réduire les impacts des restrictions de santé publique. Mais cela étant dit, c'est très frustrant d'avoir une petite minorité des gens qui ignorent publiquement les mesures et les règles de santé publique parce que c'est une insulte envers toutes les autres, la grande majorité des propriétaires des petites entreprises, des Albertans, monsieur, madame, tout le monde, qui suivent les règles et qui font les sacrifices. C'est une insulte envers leurs voisins de faire les actions comme ça, et particulièrement pour les élus, pour les dirigeants élus des communautés, d'endorser effectivement ces actes illégaux, parce que ça nuit à notre capacité à garder la santé publique et protéger le système de santé publique, les hôpitaux. Et c'est la raison pour laquelle, écoute, depuis le début, on a mis l'accent sur l'éducation publique et pour encourager les gens à suivre les règles et d'utiliser l'enforcement de la loi comme une dernière ressort. Mais je crois de plus en plus, il faut que les agences responsables mettent en vigueur les réglementations de santé publique parce que sinon, ça va créer une situation inacceptable. Mais enfin, je dirais que c'est irresponsable et ça, en bout de ligne, c'est une menace aux vies des gens vulnérables de nos communautés. Ce n'est pas responsable. Thank you very much, everyone.